and you have offended a Shaolin temple.
You can't handle the truth.
Surely you can't be serious.
I am serious. And don't call me Shirley.
Radical Rant.
Today we want to talk about Dr. Sanjay Gupta's marijuana evolution in an op-ed published yesterday on CNN entitled, Why I Changed My Mind on Weed. I've changed my mind on weed a bunch of times. Never mind. Dr. Sanjay Gupta, a neurosurgeon once tapped by President Obama to be our nation's Surgeon General, he refused, probably be a pay cut, he apologized for misleading our country about the medical benefits of cannabis. He said, quote, I apologize because I didn't look hard enough until now. I didn't look far enough. I didn't review papers from smaller labs in other countries doing some remarkable research, and I was too dismissive of the loud chorus of legitimate patients whose symptoms improved on cannabis. End quote. Wow, I have to give credit to the man for his intellectual honesty. Dr. Gupta, unfortunately, is too rare among his medical colleagues in applying the same rigorous investigation into the science behind cannabinoid therapies. It is a testament to the power of social opprobrium, government propaganda, and political pressure that so many medical professionals still fail to be skeptical of the government's claims about marijuana. It was just 11 years ago, when there were only 8 medical marijuana states, when Dr. Gupta gave this 2002 interview to CNN, explaining about the links between marijuana use and psychosis. Here's some of the quotes from Dr. Gupta just 11 years ago. Marijuana use earlier in life actually may lead to an increased 30% increase in schizophrenia later in life. Schizophrenia is a very complicated diagnosis. You get all sorts of symptoms, hearing voices, disorganized speech, withdrawal, paranoia, for example. That's a very complicated picture within the brain. The fact that this THC can actually cause these things is just becoming known now. All of these boys and girls, particularly girls, were more vulnerable to the symptoms of depression later on in life, again, if they were frequent or even daily marijuana users. Marijuana can offer some of these medical benefits, especially when it comes to reducing nausea and vomiting. Not advocating that necessarily myself. I think there are other ways to do that besides marijuana. End quote. So even when Dr. Gupta could begrudgingly admit that cannabis helps reduce nausea, he couldn't recommend it, and he believed there were other solutions. By 2006, Colorado and Nevada were pressing ill-fated initiatives to legalize marijuana for recreational use. This article by Dr. Gupta, entitled, Why I Would Vote No on Pot, was run in 2006 and then rerun in 2009 as California geared up for the failed Prop 19 legalization measure. At the time, Dr. Gupta was, quote, constantly amazed, end quote, that after all the government anti-marijuana ads and the continued criminalization of cannabis, some 15 million people, back then, were regular users. Still, 4 years after his 2002 interview, he seemed a little more willing to admit medical benefits of cannabis. Here's a quote from his 2006 article. Several recent studies, including a new one from the Scripps Research Institute, show that THC, the chemical in marijuana responsible for the high, can help slow the progress of Alzheimer's disease. In fact, it seems to block the formation of disease-causing plaques better than several mainstream drugs. Other studies have shown THC to be very effective anti-nausea treatment for people, for cancer patients undergoing chemotherapy, for example, for whom conventional medications aren't working. And medical cannabis has shown promise in relieving pain in patients with multiple sclerosis and reducing intraocular pressure in glaucoma patients. But despite this recognition, Dr. Gupta opposed marijuana legalization for non-medical purposes, explaining that, quote, marijuana isn't really very good for you, end quote. A condition that alcohol and tobacco don't seem to have to meet. After mentioning the National Institute on Drug Abuse's Nora Volkow and her opposition, Dr. Gupta trotted out the same tired old criticisms of pot. He said, quiet, dogs. That's not what he said. Frequent marijuana use can seriously affect your short-term memory. It can impair your cognitive ability. Why do you think people call it dope? And lead to long-lasting depression or anxiety. While many people smoke marijuana to relax, it can have the opposite effect on frequent users. And smoking anything, whether it's tobacco or marijuana, can seriously damage your lung tissue. Now, I corrected many of Dr. Gupta's mistakes in a piece I wrote for Normal in 2009, but to summarize, marijuana only affects short-term memory while you're high. It has no lasting effect on cognitive abilities, even among long-term heavy users. It is a valuable medicine to treat depression and anxiety. It is relaxing, even for frequent users. And while long-term pot smoking will give you a cough, it does not lead to increased incidence of COPD, head, neck, or lung cancer. Later, in the summer of 2009, Anderson Cooper's show on CNN presented America's High, the case for and against pot. In this interview, Dr. Gupta had even more glowing recommendations for the medical use of cannabis. He said, quote, "For example, someone who's having terrible malnourishment or terrible nausea as a result of chemotherapy or being infected with HIV/AIDS, using marijuana could stimulate appetite. Neuropathic pain, Anderson, something I deal with quite a bit as a neurosurgeon. It's that lancinating nerve pain that's often caused by trauma or some sort of injury or surgery. Sometimes it can be very refractive to pain medications. Marijuana can help there as well. Multiple sclerosis, something else that I treat. That's something that can cause significant tremors, for example. Marijuana can help." End quote. But even then, even in late 2009, Dr. Gupta hedged his bet by explaining that, quote, "sometimes other medications which we know more about may be better alternatives," end quote. And that's something I call the marijuana as medicine of last resort thinking. But now in 2013, in his latest op-ed, foreshadowing his upcoming documentary Weed on CNN this Sunday, Dr. Gupta explains that the emperor wears no clothes, saying, quote, "I mistakenly believed that the Drug Enforcement Agency listed marijuana as a Schedule I substance because of sound scientific proof. Surely they must have quality reasoning as to why marijuana is in the category of the most dangerous drugs that have no accepted medicinal use and a high potential for abuse." Well, yes, it's called culture war, and don't call me Shirley. He continues, quote, "They didn't have the science to support that claim, and I now know that when it comes to marijuana, neither of those things are true. It doesn't have a high potential for abuse, and there are very legitimate medical applications. In fact, sometimes marijuana is the only thing that works." End quote. No more medicine of last resort. Dr. Gupta seems genuinely shocked that not only the government, but the medical profession has been kept ignorant of cannabis as medicine. He notes the LaGuardia report of 1944, which recommended marijuana decriminalization. He discovers cannabis has been a popular medicine in the U.S. pharmacopoeia from 1840 to 1943. He recognizes that over 20,000 studies have been performed on cannabis to date, even as he notes the dearth of studies undertaken to prove marijuana's benefits. He even seems exasperated by the conundrum of the government's claim that there is no good scientific evidence for cannabis's benefits to justify legalization, while stifling any scientific research that would provide good scientific evidence for cannabis's benefits. In closing, Dr. Gupta promises to provide more honest reporting on marijuana. Quote, "When marijuana became a Schedule I substance, there was a request to fill, quote, a void in our knowledge," end quote. In the United States, that has been challenging because of the infrastructure surrounding the study of an illegal substance, with a drug abuse organization at the heart of the approval process. And yet, despite the hurdles, we have made considerable progress that continues today. Looking forward, I am especially intrigued by studies like those in Spain and Israel, looking at the anti-cancer effects of marijuana and its components. I'm intrigued by the neuroprotective study by Lev Meshulam in Israel and research in Israel and the United States on whether the drug might alleviate the symptoms of PTSD. I promise to do my part to help, genuinely and honestly, fill the remaining void in our knowledge. End quote. Well, better late than never, Dr. Gupta. Glad to have you on our side. Thanks for joining us. We've been saying these things about marijuana for, 5 years now on the Russ Belville Show. Tune in sometime, Doctor. You might learn something. That's all the time we got for today. Thanks for joining us. On tomorrow's show, we'll have our exclusive interview with Miami Beach mayoral candidate Steve Burke. We'll also do a little previewing of our upcoming events here in the state of Florida, which include interviews with Kathy Jordan and Robert Platshort. Thanks for joining us here in beautiful Miami, Florida. I'm Radical Russ. Until next time, take care of each other, toasters.
This is the Russ Belville Show. The Russ Belville Show is blogging and podcasting daily at radicalruss.com.
You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it. You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it. You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it.
Now it's time for your 420 Radio News for Wednesday, August 7th, 2013. I'm Russ Belville. U.S. Drug Agency Surveillance Unit to be investigated by the Department of Justice. This from theguardian.com. The U.S. Department of Justice has launched an investigation into revelations that the Drug Enforcement Agency uses surveillance tactics, including